Here's a great tip so you can become a willing bystander. Hi, we've all heard about strains and sprains and fractures. They're known as musculoskeletal injuries. Well, you know, sometimes someone goes over on their ankle or they trip and they fall and they hurt their elbow or their hand, and people come up and go, "Oh, don't move that. I think it's broken," or "I think you sprained it," or, well, what exactly is the difference? Well, a strain is when you stretch or pull or tear your muscles or tendons. So if I was trying to lift something that was too heavy, I might strain my muscle or the tendon down here. I might stretch it or rip it. That's what a strain is. How do we know someone has a strain? It hurts. They have pain. They have swelling. They have bruising. They have a lack of movement. They don't want to move their arm anymore. Hi, do you want to keep lifting? No, I don't. What's the treatment for a strain? Well, we want to rest it. We want to immobilize it. We're not moving it. We want to put some ice on it to cool it down and shrink the blood vessels and reduce the swelling that's going to that injured area. Now, what's a sprain? You know, you've seen someone go over on their ankle or twist their ankle or fall down and hurt their wrist or something like that. And, you know, well, a sprain is when the ligaments get stretched or torn, and ligaments attach bone to bone. So if you stretch that ligament in your wrist or your elbow or your knee or your ankle and you go over on it, you stretch those ligaments. How do you know that's happened to someone? There's pain, swelling, bruising, a lack of movement. They don't want to stand on their ankle anymore. They don't want to move their wrist. It's sore, right? So what's the treatment? We immobilize it, we rest it, we put ice on it, we can elevate it if we're able to without causing any real further pain. So that's what's going on with a sprain. So what's a fracture? Well, a fracture by definition is a break in the continuity of the bone, which is a very fancy way of saying the bone broke. Now it could either be an impact and it broke, or it twisted and it broke, or it got hit by something and it broke. The point is, the bone is fractured. How do we know that that's happened to someone? Pain, swelling, bruising, a lack of movement. And sometimes with fractures, the bone can actually stick through the skin, and that's called an open fracture. But you see, strains, sprains, fractures, they all basically look the same, they feel the same, and guess what? We treat them the same. For a fracture, we want to immobilize it, we want to rest it, we want to put some ice on it, keep it still, get the person to the hospital. You know, over the years, we've seen people walk up and go, "Oh yeah, look at that, I think he broke his ankle." And it's like, wow, this person must be Superman, because you know what? We actually need an x-ray to determine. So you know what? All of these injuries look the same, treat them all the same, and you don't actually have to know what it is. Just take care of your patient and get help for them. Thanks for watching this video. Now you're a willing bystander.